It's Thursday, April 8, 2021. Good morning. Welcome to the local news for today. My name is Shanine Wilfrid. In the news, 18 persons infected with new COVID-19 variant. Cuban doctors working in the interior should be maintained. COVID-19 measures tightened and World Health Day commemorated. 18 persons have been infected with the new variants of the COVID-19 virus. This was shown by a result received by the Public Health Care Office, BOG, of the 72 samples that were sent abroad for sequence analysis. The results confirm the presence of the British, South African, and Brazilian variant. According to Rajesh Ori, acting director of BOG, these variants are more contagious than the normal variant. The chance of brain diseases is greater. It is not yet possible to do a sequence analysis in Suriname. By means of sequence analysis, it can be determined with which variant the person is infected. The symptoms of this are visible within 2 to 14 days. The chance that people who have already administered the AstraZeneca COVID-19 vaccine getting seriously ill is much less. Ori indicated that these three variants have been in Suriname since March. It is unclear how they made their way to Suriname. There has been an increase in the daily number of COVID-19 cases. The Cuban doctors who are deployed in the interior of Suriname for primary care should be maintained. That is the position of the residents of the interior, MP Edgar Sampi learned from information obtained. In a letter he managed to get hold on, it indicated that the Ministry of Health is preparing to recall 18 Cuban doctors. According to the MP, the inland residents do not know which way to turn. The MP also indicates that the Ministry of Health had not communicated with the target group about this matter. But contrary to Sampi's information, Minister Amara Madin claimed that the Cuban doctors are not being sacked. These medics are stationed at different posts of the medical mission and the regional health service. The government had recruited Cuban medical experts to increase access to health care, especially in the interior. In 2007, research found that 250 general physicians and 100 specialists were needed for the interior. Not everyone was happy with the arrival of the Cuban doctors, with the result that they have encountered some resistance. Edwin Norte, coordinator of the Cuban mission, confirms that preparations are underway to expel the Cuban doctors. The departure of the Cuban doctors will be a drain on the interior. If it is really the case, the ministry must then deploy Surinamese doctors to guarantee health care. So says Director Herman Ginty of the medical mission, who also emphasizes that this decision must be looked at with due diligence. As of today, new COVID-19 measures are in effect. According to Amara Madin, Minister of Health, the new COVID-19 variants, the British, Brazilian, and South African, occur also in Suriname. The new COVID-19 measures go into effect from today, Thursday, April 8, until Wednesday, April 21. The lockdown applies from Monday to Friday from 8 p.m. to 5 a.m. and Saturday and Sunday from 6 p.m. to 5 a.m. The World Health Organization calls for the pursuit of a fair and healthier world. It does this in connection with World Health Day, yesterday, April 7th. The Ministry of Health is, according to Minister Amara Madin, right behind this call, especially because of the COVID-19 pandemic. The minister denounces the fact that in the past period, despite various calls from the government, citizens are endangering their health and that of others by acting irresponsibly. In connection with World Health Day, President Chan Santuki participated in an online discussion theme, Changing Paradigms in a Pandemic World. In his presentation, the head of state emphasizes that bringing people together, the key is to create a better, prosperous, safer, and healthier society. According to the head of state, this is the motivation for this government in tackling the poverty and the economic crisis in Suriname.
Challenging times. international cooperation and collective action is more than ever required to foster equality and solidarity. This will undoubtedly steer our future actions in the fight against the COVID-19 pandemic, when we must be vigilant to make sure that the COVID-19 vaccines remain available to developing countries and not merely to the developed countries. Therefore, it is of utmost importance to combine our efforts to work constructively together.
According to President Santoki, it is important that in line with the theme of the World Health Day, developing countries should also have plenty of access to COVID-19 vaccines. These were the local updates for today. Thank you for watching. Tomorrow we will be back with more. Have a nice day and stay safe. Goodbye.